Alright, so previously we were talking about the clinical symptoms of migraine, and I was giving you an overview. The clinical features of migraine, and yeah, I was giving you an overview on it lah. A typical cause of migraine starts with the patient getting some premonitory symptoms, usually for a few hours, followed by the development of an aura in a classical migraine. That's like 10% of patients, and there's no aura for actually most people. Then some people will end up with a headache, and some people will end up with no headache, or the headache doesn't really bother them that badly, and it's the aura which actually bothers them. So later on we'll hear terms like migraine with aura, migraine without aura. Like you can have an aura without a headache. Yeah, migraine aura without headache, or sometimes it can, and which makes all these things like really confusing lah. Because imagine if you have an aura of motor symptoms without a headache, then the thing would be you'll think TIA. If you have an aura in very close relation to a headache, you might think an SAH, because you might think like, oh, maybe the SAH ruptured, then it caused the weakness. So, but the typical cause of a migraine has very specific temporal relationship lah, classically, okay? Classically, these patients will have premonitory symptoms for a few hours, followed by an aura of about 5 to 20 minutes, lasting to about less than 1 hour. Then after that, they develop headache. That's the typical cause for most people. And honestly, with regard to my relative who has migraine, she has migraine without aura, and she's never had like anything severe enough to suggest like a TIA or stroke. So yeah, that's in general. So premonitory symptoms: aura or no aura, headache or no headache. Premonitory symptoms are defined as symptoms that precede the migraine attack by several hours to 2 days. Okay, so what I'll do, as you can see, I will elaborate on each of these. I'll elaborate on premonitory symptoms, then I'll elaborate on aura, then I'll elaborate on the headache, what kind of headache it is. Okay, so premonitory symptoms are symptoms that precede migraine attack by several hours to 2 days. And the typical symptoms I listed here, everything from fatigue, yawning, pallor, nausea, blur vision, photophobia, phonophobia. In the case of my relative, I think she has like she just feels down, so that perhaps could be a premonitory symptom for her. And she feels a bit tired as well. The migraine aura, so now I'm elaborating on aura, okay? It's defined as a complex of neurologic symptoms that accompanies the migraine headache. It's believed that, as just now as I mentioned, the cortical spreading depression is the one that spreads to certain regions of the cortex. It is perceived by the patient, and this corresponds to the manifestations of aura. Okay, so if it spreads to say the motor cortex, then you get motor weakness. If it spreads to say the Broca's area, then you get speech disturbance. If it spreads to say occipital lobe or parietal lobe, then you get visual disturbance. Sensory cortex, you get sensory disturbance. Okay, so typically the auras occur just before the onset of the headache, but in quite some cases they actually develop during or after onset of headache. And if it develops after the onset of headache, this becomes quite a diagnostic dilemma lah, because now it becomes, you think, could it be SAH? And indeed it could, right? Because if you have headache, then weakness, then you think SAH, right? Classically, the typical auras that can occur are visual, sensory, motor, or speech disturbance. Visual disturbance, usually they actually see zigzag lines going in a pattern usually around one hemisphere. It's usually a homonymous visual disturbance. That means the visual areas in which it occurs match. So it could be nasal, or it could be temporal. It could be nasal, temporal, or like left nasal and right temporal, or like right. Okay, yeah. You know what homonymous is lah. Sorry, I'm getting a bit confused here. But basically, they occur on the same sides of the visual field lah. Okay. With regards to the sensory disturbance, it starts in the hand and it goes up the arm to the face and tongue. In motor disturbance, you get a weakness of hand and arm on one side, and the weakness may be permanent after multiple attacks. Speech-wise, yeah, they get like aphasia lah. Yeah, one thing you must note is that these things are like quite acute, and you really only want to diagnose migraine with aura if the guy has like had it before and had a good evaluation, because you really don't want to miss a neurologic. I mean, you don't want to miss some infarction or something, which I will go to indications for brain imaging in people with migraine. The time course, usually as I mentioned, is less than 1 hour. Anything more than 1 hour is a red flag. If it's more than 1 hour, it's a complicated migraine already. If it's more than 1 week, it's migrainous infarction. The person got a stroke from migraine. Sorry, I didn't qualify here. If it's more than 1 week and there must be evidence of infarction on imaging, then it's called migrainous infarction. If it's more than 1 week and there's no evidence of infarction on imaging, then it's just simply called persistent migraine with aura. Okay. The visual disturbance, as I mentioned, is I present here. Migraine comes with autonomic and sinus symptoms, such as you can see here, rhinorrhea, nasal congestion, tearing, color and temperature change, and syncope and orthostatic hypotension are indeed more common in people with migraine than those without. However, this also leads to a misdiagnosis of sinus headache in people, because you can see like if they have rhinorrhea, nasal congestion, and unilateral headache, then of course you might think it's acute sinusitis on one side. But what goes against the diagnosis of a sinus headache will be that there's no purulent discharge, there's no fever, and there's no signs and symptoms of acute sinusitis. Like maybe when you percuss the sinuses, it's not tender. Cutaneous allodynia can happen in migraine, and it's a perception of pain which is produced by innocuous stimulation of normal skin. So allodynia is when you get pain due to innocuous stimulation. Pain due to innocuous stimulation. It's believed to be due to neurogenic inflammation sensitizing your central pain pathways. And the clinical manifestations are that of scalp and trunk allodynia, or a combination of both. In scalp allodynia, the patients would complain of it being painful on the site of the headache when they brush their hair, touch their scalp, do something non-innocuous, maybe if they get a kiss on the same side as well. Menstrual migraine is when a patient gets migraine headache in close temporal relationship to menstruation. So that means 2 days before or 3 days after. They think that perhaps it could be due to decreased estrogen levels around the time of menstruation, which is why one of the treatments for menstrual migraine is actually to give low-dose supplementary estrogen as long as there's no contraindications. Menstrual migraine is clinically manifest by a migraine without aura. Even if the patient normally has aura, now they get a migraine without aura near the menstruation. And some experts believe that it might indeed be longer, more severe, and more difficult to treat than other kinds of migraine. What are the precipitating and exacerbating factors for migraine? I just listed them here. If you guys want a copy of the slides, you can email me and I'll send you guys one. A lot of factors have been indicated. Okay, I'll spend a bit more time to talk about the complications of migraine because it's quite important. Migraine can become a chronic form where a patient gets 15 or more days a month for more than 3 months in the absence of medication overuse. And this is believed to be due to the neurogenic inflammation of migraine, sensitizing the central pain pathways. Status migrainosus can happen to anyone with migraine, and it's when they get a debilitating migraine attack more than 72 hours. So note again, migraine typically, as I mentioned just now, lasted less than 72 hours, right? Now it lasts more than 72 hours. Auras of migraine, as I mentioned, last typically less than 1 hour. But now when you see migraine with prolonged aura, persistent aura, migrainous infarction, all these things last more than 1 hour. I have to stop now because it's 10 minutes.